Now to a highly controversial report from the Office of the Auditor General on whether the state undercounted COVID deaths in long-term care facilities.
It was released early to Local 4 and says the state missed nearly 2,400 deaths, but that may not be the whole story. Grant Herms joins us now because, Grant, the state and even parts of this report question these findings, right?
Right. Now, we were able to get our hands on this 13-page report several days before it was released, but the governor and the state health department are pushing back against these findings, which admit there are limitations and warnings about the numbers that it's using.
The review obtained by Local 4 isn't set to be released until this coming Monday. In it, the Auditor General leads off by saying it does not meet state standards for an official audit, but saying, quote, "We have no reason to question the accuracy." The review shows disputed numbers, 8,061 deaths in long-term care facilities, adding nearly 2,400 deaths to the state's total, although does say the state accurately tallied and reported all of the 5,675 COVID deaths in long-term care facilities between January 1st of 2020 and July 7th of last year. The report also admits there are limits to the data used, echoing recent complaints from the state health department and the Whitmer administration that the OAG used broader definitions outside CDC guidance for both a COVID death and a long-term care facility, meaning the state wouldn't have collected those numbers in the first place. That accounts for about 10% of the difference. That still leaves a 19% increase coming from places that would have been required to report deaths to MDHHS. But again, those numbers are disputed by state officials who say the data came from an unreliable state database. The report also includes multiple warnings from the OAG about numbers from unidentifiable facilities, probable but unconfirmed COVID deaths, and deaths potentially mislabeled as COVID where patients had a negative COVID test at the time of their death.
The Republicans are saying this is evidence of wrongdoing on the part of the governor. In a statement today, the governor's press secretary, Bobby Leddy, saying in a statement to us, throughout the pandemic, the state of Michigan closely followed the data and science within the CDC's guidelines to slow the spread of the virus and save lives. The Office of the Auditor General confirmed Michigan counted 100% of COVID-19 deaths that were reported to the state per CDC guidelines. In Detroit, Grant Herms, Local 4.